Hello and welcome to the ProVac eToolkit training modules. My name is Nathalie Elomeri. I'm an epidemiologist at the Pan American Health Organization. In this module, I'll provide you with a brief introduction to PAHO's ProVac initiative. In this video, we will cover the purpose and audience of this training module, the background and history of the ProVac initiative, how ProVac provides technical support to countries, what makes it so unique, the list of countries ProVac has supported to date, and finally some concluding remarks. The purpose of this training module is to provide you with an overview of the ProVac initiative. This includes what the initiative is, the type of help it provides to countries, and what makes it so unique. The audiences we intend to reach with these modules are National Immunization Program staff interested in performing an economic analysis, relevant literature review, etc., with the support from the ProVac initiative. National health policymakers who will be the recipients of the study results and will use them to inform a real-world immunization policy decision. And stakeholders, be they governments, academics, or others, interested in understanding how ProVac analyses are developed and supported. PAHO launched the ProVac initiative in 2004 with the aim to enhance national capacity to make evidence-based policy decisions on the introduction of new vaccines in the Americas. This was in response to a growing need for weighing the economic and health benefits of vaccine introduction decisions in a resource-constrained setting. The sustainable introduction of new and more expensive vaccines continues to be a challenge for national programs throughout the region. Additionally, countries expressed a desire to own their decisions and to base them on a broader evidence base with national data whenever possible. PAHO recognized that supporting nationally based processes required an infrastructure. In the transition to primarily country-based decisions, national advisory bodies and decision-making authorities must have the technical capacity to ensure decisions are based on rigorous and informed deliberations. The ability of a country team in a low or middle-income country to incorporate decision-makers' preferences, the perspectives that are most relevant for their country, and the data that reflect their local context, makes it possible for them to understand, use, and defend the evidence being used. ProVac's goal is to strengthen evidence-based decision-making on immunization policies to sustain and further the program's public health impact. It does so by supporting country teams to improve their technical capacity, providing them with training, methods, and tools. Furthermore, through its activities, ProVac strives to strengthen the national infrastructure for decision-making, develop tools for economic analyses, and provide training to national multidisciplinary teams, participate in data collection, conducting analyses, and gathering a framework of evidence, advocate for evidence-based decisions, and support countries to effectively plan for new vaccine introduction when evidence supports it. ProVac's main areas of work encompass economic evaluations of new vaccine introductions, immunization program performance optimization, post-introduction assessments of vaccine impact, and national technical advisory group strengthening. ProVac provides evidence generation at all stages of decision-making. In the pre-introduction stage, ProVac supports countries estimate disease and cost burden, model the incremental benefits, risks, and costs of a vaccine being considered for introduction, conduct a cost-effectiveness analysis of a given vaccine or group of vaccines, or even conduct a budget impact analysis to appraise the potential impact to the national health budget if a vaccine were to be introduced. The ProVac initiative has over a decade of experience supporting evidence-based immunization policymaking in the Americas and beyond the region. It has spearheaded regional policies and influenced global efforts. Among the initiative's key achievements are the training of over 300 professionals from 25 countries, supporting 17 national multidisciplinary teams with cost-effectiveness and costing studies, and contributing to the strengthening of 20 national technical advisory committees on immunization through peer collaboration. Much of the success of the ProVac initiative is due to its unique approach for supporting countries. Unlike similar regional or global efforts, ProVac focused a great deal on not only providing countries with the needed technical support, but also building in-country technical capacity by bringing together local experts from the ministries of health, governments, and academic centers. The way ProVac prepares and facilitates national economic analyses promotes country ownership of the process and of the findings. The result is an evidence-based decision-making process that is more likely to sustain the public health impact of the immunization program. The ProVac team is characterized by its technical expertise in economics, epidemiology, and decision support modeling. The team also has a deep understanding of the challenges faced by low and middle-income countries when trying to make informed and timely immunization policy decisions. It includes members from PAHO's technical officers on immunization, the London School of Hygiene and Tropical Medicine, and the Center for Health Decision Science at the Harvard School of Public Health, as well as other academic institutions across the region. ProVac helps countries conduct their own decision analyses by supporting the creation of a ProVac national team. The ProVac national team is a multidisciplinary group of Ministry of Health experts and the national ProVac consultant who is hired to support a specific analysis. The ProVac national team presents the results of the analysis to the National Immunization Technical Advisory Group, or NITAG, who then uses it as part of the evidence base to issue a formal recommendation to the Ministry of Health. The Ministry of Health then makes an informed decision. ProVac strengthens the framework for vaccine policy making at the country level. National ProVac teams not only review the technical evidence during a study, they also discuss and are able to incorporate the national perspective on social, operational, and programmatic aspects around an immunization decision. Having this national perspective and ownership of the analysis is essential for the recommendation to be listened to by national authorities, and it also generates a sustainable impact in the program. Additionally, with the development and continuing improvement of user-friendly yet scientifically robust cost-effectiveness and cost analysis models, ProVac has provided national teams with the tools they need to conduct a timely and real-world analysis. ProVac has trained hundreds of professionals through regional workshops and directly supported 17 national teams conducting 47 economic evaluations. While ProVac is a PAHO-based initiative and is primarily focused on providing training and direct support to countries of the Americas, its tools and methods have had a global reach. ProVac models and tools are currently open access resources and have been used in partner collaborations to support countries in other regions of the world, as shown on this map. To conclude, it's important to reiterate that the ProVac initiative's methods promote country ownership of the process and of the findings. The result is evidence-based decision-making that is more likely to sustain the public health impact of the immunization program. ProVac not only provides technical support to countries for a specific analysis, but also builds in-country technical capacity by bringing together local experts from the ministries of health, governments, and academic centers. For additional information on the ProVac initiative, you can visit our website shown on this slide, and you also have the link here to the access to the ProVac toolkit with all of its training material. We hope you found this module informative. Thank you for your time, and don't hesitate to check out our website. Thank you again.